In a recent survey, a staggering 94% of optometrists questioned agree that, as a nation, we take insufficient care of our eyes, and 70% think that patients are suffering from eye conditions at a much younger age. So why are we not taking our eye health seriously, and what are the implications?
We don't tend to go as often as we should to our local opticians because we tend to only seek advice regarding our eyes when there's a problem. In the same way that we go regularly to the dentist, so the dentist can pick up dental problems, we should be seeking a regular eye health check at our local optometrist, because there are a number of conditions that can be picked up even if we're not experiencing any symptoms, such as skin cancers around their eyes, for instance, glaucoma and macular degeneration. As an ophthalmic and oculoplastic surgeon, I'm certainly seeing younger and younger patients present with common conditions such as blepharitis and dry eye. In fact, dry eye can potentially be quite serious. So in its milder forms, a dry eye could just cause irritation, burning and stinging, but in its much more severe forms, a dry eye can cause ulceration of the eyes, infections, scarring, along with even permanent loss of vision.
Belinda Geddes has a long history of eye problems and has had to undergo extensive and unpleasant treatment and procedures to correct the problems.
Well, I started off with short sight when I was young and just had lenses for that for years. But then I started to develop high pressures in my eyes, and for about a dozen years had drops to prevent glaucoma. I had to have my left tear ducts cauterized because I had plugs put in them to start with, and then the upper tear duct, the plug wouldn't stay in. It kept falling out, kept dropping out, and had to have surgery a year or two ago. And just before that, I'd also had cataract surgery. So I've had a lot of eye surgery, eye drops, eye issues.
Spectrum Teya, a leading ophthalmic company, have launched their 2020 Vision of Britain report that examines the impact of modern society on the health of our eyes. It's not just old age, but pollution, poor diet, smoking, increased use of screens and computer-based devices.
So when seeking out treatments for dry eye and lid margin inflammation, it's important to apply preservative-free preparations. We know that preservatives can irritate the eyes, particularly when lubricants are used on a frequent basis. And so we've seen that preservative-free lubricants are often the best way to treat a dry eye, and preservative-free lid cleansing products are the best way to perform lid hygiene to maintain optimal ocular comfort.
The thing that I tell people to do is to go and see an optician even if they don't think they've got any eye problems, because whilst you know if you've got dry eyes because you feel the discomfort, and obviously you know there's something there that's not quite right, and hopefully you will get that seen too, you don't know if the pressures in your eyes are too high, and you could be risking blindness, and there's nothing they can do about that once you've lost your sight through the pressure. So I'm a great advocate for going to the optician even if you think you can see perfectly well.